Hi, I'll be talking about the various aspects of sports medicine. Sports medicine involves two particular group of sports per se. One is called as the active sports, and the second one would be a recreational sports. So we see a lot of young people and old people involving in a lot of recreational sports. So that it also has equal tendencies of injuries, just like that of active sports on international levels. So before we start on to anything on sports medicine, the most important aspects which we should know is the body weight, the body height, and your composition of body, the amount percentage of fat in the body, and how your muscles wear. In India, we need to be particularly cautious about the nutrition part, which is a very important part because of the varied different kind of nutritional background of people. In particular area, people are extremely vegetarian, and the other areas, there may be extreme consumption of non-vegetarian food, and they may be deficient in certain vitamins, whereas the vegetarian people may be deficient in certain vitamins. So when you are into a particular sports, it's of utmost importance that all the particular major macronutrients, including proteins, as well as the micronutrients, vitamins and minerals, should be optimally given. Sports injuries, the most common reason that has been described is because the recouping after a particular episode of sport is not happening, and over time patient tends to get a recurrent kind of injuries. For example, vegetarian food is often deficient in proteins as well as vitamin B12 like vitamins. If proteins is deficient and minimally deficient, each day person goes for sports and his nutrition is deficient on a certain types of amino acids, and they do not recover fully, and when it is continuously again and again trained, these muscles can go into an injuries, and we don't find a reason for this, and patients, by the time they are reaching into the peak of their careers, they tend to have troubles with their muscles. So having a basic knowledge about optimization of proteins, the type of proteins that is being consumed, and also knowing about vitamin D and vitamin B12. Vitamin D deficiency has become an epidemic proportion in India in spite of we having sun almost 12 months of the year, because people are staying more and more indoors, and even in sports persons we have seen majority of the sports persons are vitamin D deficient, especially if they are doing most of their trainings in an indoor setup. So from sports nutrition, second most important thing that each sports person should also consider, which we commonly find in these international sports persons, is in the off period they tend to put on weight. That is, during the active sports time, the amount of food that they are consuming or the calorie consumption remains same even in the off period, and they tend to put on 3 to 4 kgs of weight during the off period, and when they come back into their active sports, they are overweight and they tend to cause injury. So it's a very critical balance in the amount of strength and in your body weight and getting the muscles recouped after each episode of sport. A very common problem that we face in Indian sports persons often is the off-camp and on-camp period time. In the off-camp period time, they tend to consume the same amount of calories and proteins as they were consuming during the camp period, and 45 days or 2 months time, they add on some 3 to 4 kgs and come back to the next camp. And this body weight increase, unless and until it comes down to the original level, their chance of getting an injuries or stress injuries to the knee, shoulders and all tends to become real high. So in toto, in sports nutrition, what people have to know: one, get each time they go into game, and by the time game ends, as early as possible the necessary carbohydrate as well as the protein consumption should be taken. The quality of the protein should be considered as very important. It should be matched for all the amino acids, especially if the sports person is a vegetarian, and in appropriate people the vitamin B12 and vitamin D supplementation should often be given. There's a very common sports injury called as stress fractures, and which is very common if you are overweight, if your muscle power is comparatively less, if your vitamin D is low, if your vitamin B12 is low, you tend to cause these stress fractures. And stress fractures take away 3 to 4 months, vital months of these sports persons, and their career can itself be dwindled. We have had our national level athletes having these kind of problems. When the appropriate problems were found out and treated accordingly, they have gone on to break many records for the country.